Hello and thank you for joining me today. I am Amit. I will be presenting a qualitative account of the digital mental health experiences of women from refugee backgrounds. We conducted this research in partnership with a women-led charitable organization in the UK. We used a set of visual cards to explore mental health needs. The design of the cards aims to support both researchers and participants in sharing and understanding mental health views and experiences. For example, the first card illustrates a holistic mental health understanding. It says, "Mental health is something we all have. People from all over the world think and talk about the mental health in many ways." Each card comes with an open-ended question to facilitate conversations. For example, what thoughts come to mind when you hear the term mental health? The fourth visual card covers coping strategies. For example, we ask the question, what do you do when you had a tough day? The last card acknowledges that technologies can also affect our mental health in different ways. It shows questions such as, what are your favorite technologies? Are there any technologies that you avoid? As this work was conducted at the time of COVID-19 lockdown measures, we used an online survey to present the visual cards. We closely worked with 2 community workers who piloted the study and shared our research effort within the community for women from refugee backgrounds. 15 participants completed the online survey. 9 participants decided to take part in the follow-up interview. 10 participants described their ethnic background as African, 3 as Asian, and 2 as white. Participants reported experiencing a wide range of mental health challenges, including stigma, loneliness, and uncertainty. For example, a participant described her fear of receiving mail in case they had to do with her residency status. She said, "So the letters in the post definitely scare me a lot. So keeping these thoughts makes me feel uncomfortable. Same like you get scared sometimes. What's going to happen?" Participants' accounts document their collective agency in addressing these challenges and supporting social connectedness and well-being in daily life. For example, participants reported they enjoyed volunteering for and taking part in community activities such as yoga, reading, and art classes. One participant used the term tribe to describe her sense of social connectedness and belonging. Another participant reflected on her experience within the community, quote, "Everybody's the same, they treat us the same," which highlights her sense of equality. Technology played an important role in supporting experiences of social connectedness. The charitable organization went through a digital transformation during lockdown measures. For example, a community worker explained, "Technology, it helps us so much that it changed our lives." Community workers formed a network of WhatsApp groups and taught their members how to use Zoom. However, they also highlighted digital inequalities, including a lack of multilingual support and access to internet-connected technologies. Instead of using mental health apps such as Headspace, participants reported using a wide range of non-mental health focused apps. For example, one participant used Instagram to learn about empowerment and independence. She reported, "There's this lady and she's a mom of 4 kids, and really she's very independent. She empowers the other woman to be, you can do it, you can be anything, you can do everything." In summary, we have investigated the mental health needs of women from refugee backgrounds in partnership with a charitable organization. Our findings highlight the collective agency of the charitable organization and their volunteers in supporting experiences of social connectedness and well-being. The charitable organization provided safe spaces for social exchange, offered volunteering opportunities, and organized regular events such as yoga and dancing classes. In addition, they tackled digital inequalities through organizing donations of laptops and mediating digital skills. For example, how to use WhatsApp and Zoom. Importantly, participants reported adopting these mental health supportive activities in daily life, such as practicing yoga and organizing social cooking events with friends and family. They intertwined community-driven activities with self-care practices and used a wide range of non-mental health focused technologies to support their mental health. For example, participants used apps to support religious practices, play games, and share experiences of everyday living within private groups. These findings contribute to shifts from narratives that are predefined by people's refugee status to more nuanced accounts that document people's lived experience with their vigor, skills, and aspirations. Based on this understanding, we highlight the importance of exploring community-led approaches to foster inherently social mental health experiences, from altruism to connectedness and belonging. We need to support charitable organizations and their volunteering networks in addressing digital inequalities and strengthening their mental health supportive initiatives.